Overall, what's the sentiment of residents in DC area where you live? How do people cope with COVID-19?
I think in the DC area, the stay-at-home orders or the stay-at-home advisory started pretty early compared to other parts of the U.S. And in my view, the DC area residents are pretty obedient. I've heard a lot of my friends in the city and also in the larger DC area, we take this pretty seriously. But from time to time, you see people going outside and trying to exercise. They go for grocery shopping. But the latest I looked at the curve this morning, it seems like the DC area has flattened a little bit. But again, the U.S. is such a large country, and my understanding is that other parts of the U.S. are actually the situation are pretty critical, especially in New York, in Florida, in California, for instance. In this area, it's pretty much calmer, but again, that's because we started to stay at home quite early compared to the rest of the country.
And do you wear mask when you go outside, and how are other Americans do when they go outside?
This is pretty interesting because I started to wear a mask much earlier than anyone else, but I think CDC announced this week to advise Americans to wear a mask. So the last time I went to get some grocery, I saw a lot of Americans are wearing masks. But the problem is masks are really difficult to find. So you see a lot of creative solutions. People will put the handkerchief on, someone used a t-shirt to cover their face. But I think it's becoming more and more prevalent that Americans are wearing masks.
And with the press briefing and President Trump announced that the death toll would be quite high in the U.S., could be as high as 240,000 cases. As far as you can see, how the sentiment of people over there?
It is pretty alarming. Definitely, this is a very scary situation. But what we have seen so far, that there are so many models that predict the number of deaths and predict the number of infection. Within the community, there's a lot of debate whether or not that number could be true. But in my view, the number, yes, definitely quite scary, but any number is scary. If it's lower than 240, that's great, but it's still very scary.
And Kun Pavis, if you have symptoms or if you suspect that perhaps you will be infected, what can you do right now?
If I were to have symptoms, I would have to monitor myself, and if it's really bad, then I would have to call in. We are advised to usually interact with our doctors on telephone and then give them the symptoms that we had. If it's really bad, then I think they would recommend myself to get tested. But so far, I'm pretty fortunate that I don't have any symptoms. My understanding is, like in many other parts of the world, they try not to get people flocking to the hospital unless your symptoms are really bad. And I've heard from some of my friends as well who had really bad symptoms, but their symptoms are not critical enough for the hospital to take them in and get properly tested.
Yes. You were talking about the stay-at-home directive. Is it something compulsory, mandatory?
It varies state by state. Okay. Where I live, in the DC area, including Virginia and Maryland, the stay-at-home orders are mandatory, and you can only go out to go to grocery or to obtain essential items. But I know that there are many other states in the U.S. among the 50 states that do not have any stay-at-home orders at all. So the degree of its directives are varying state by state.
So where you live, disobeying the directive can lead you to being fined or arrested, right?
Yes, and again, the amount of fine or the amount of punitive measures vary state by state. Yes.
What about food supply, toilet paper? Because I heard from some friends whom I talked to in America that they have lots of hoarding. What's the situation in your area?
That's true. Every time I go to get some grocery, I don't see any toilet papers left. Any hygiene product, these sanitizer and whatnot. But there's food. There's a lot of food. I think I'm really grateful for food stocker and then truck drivers who still give us the continuous supply of food. So I'm not worried about food, but there's some items that it seems like people are hoarding, like tissue paper, for instance.
And
So what is your biggest concern now, Khun Pavis?
My biggest concern is the economy, the repercussion on the economy, especially in the large country like the U.S. and how it would affect the rest of the world. And the rest of the world is experiencing this too. My concern would be how would we have to synchronize going back to our previous life and how would that impact everyone in society.
And at this point, do you like to return to Thailand or you have to stay put in the US?
Well, my first choice is to stay put because I don't want to travel, but at the same time, I keep monitoring the situation, whether or not it would deteriorate in the US, especially in my area. I always look at what's going on in Thailand as well, and that moment is always a good option to have. But at this point, it seems like the situation in many other countries is getting worse and worse too, and we see a rebound in the rate of infection in Asia. So maybe going to Thailand is not a good option at this point, but I do keep contact with my family and friends.
So, and what kind of message have you been getting from the authorities in DC? Things will get better soon, or you have to put up with the conditions at least for the next few weeks or what?
Well, I think the messaging is pretty mute.
Mm-hmm.
In terms of they're pretty straightforward that this is the situation and we really have to stay away from each other. You really have to take social distancing seriously. And we get updates every day in terms of the infection rate, in terms of death rate. So I think in my view, the more honest and the more straightforward the messaging is the better because we understand what's going on, especially when you home all the time and you don't see any other communication.
Okay. So, and how do people in your neighborhood react to the President Trump's recommendation that people should wear face masks when they go out?
Well, every time I go around and do some walk in my neighborhood, people are wearing masks. Mm-hmm. So I think they listen to the authority, and I think that's a good thing, especially for measures that protect our health. So you see a shift because before the directive came out, I heard from my friends that, why are you wearing a mask? Mm. So there was a big shift in terms of people thinking about whether or not they should wear a mask. And that's something I would say, as an Asian person, I think it's a good direction to go, actually.
Okay.
And is it available everywhere right now? I mean, the face mask, cloth mask?
No, it's not. Actually, CDC advised people have to make their own mask, sewing and make their own, use their own pieces of cloth to make masks. If you go to grocery right now, you will not be able to find any mask at all. I myself was lucky that I collected masks when I was in Thailand or when I was flying between the US and Thailand. So I had some masks at home and I only use it once a week because I don't go out at all within the 7 days. I only go out once a week. Yeah.
So you have to adjust quite a lot. Khun Pavis,
going on YouTube and see how people adapt their materials to use as masks is pretty interesting to watch.